Our system may or may not accurately reflect who we are, but we can do better. Other countries have models that get better outcomes for less money. It turns out we have a similar model in our own country.
The VA is very different culture. We don't have a consumer model. All of us who work there feel that veterans deserve the very best possible care that we can give them for the resources we have. 10 years ago, the VA realized they had to make decisions differently. Costs have been flat, outcomes have improved, and patients are more satisfied. While the community, outcomes worse, costs rising out of control, and patients less and less satisfied. Now, this is basically a single-payer system that's administered by the federal government. There's an explicitness to the VA that the private system just doesn't have. You don't know who's in charge out there. You have a sense that there's all kinds of people running around who must be making a lot of money. Their buildings are the best buildings in most cities. Their waiting rooms and lobbies are small palaces sometimes. My patients wait for many elective surgeries. But it's interesting, most of them can see, gosh, I am paying less. I get in to see my primary care folks. I have a very good acute care system. They made a much more significant commitment to primary care and better information systems. Every patient I see, their chart is in an electronic record. The record is available to me in the room I'm seeing the patient. I can see what everybody's doing in the VA system. It's extraordinary. They've also used their information system to dramatically reduce errors. They get the best deals on prescription drugs in the country. Part of that is because they have an information system and a primary care system that when they communicate, here's our strategy in prescription drugs, it gets done. And the pharmaceutical companies respect that.
It's important here to understand that Dr. Santa is talking about VA hospitals, not military hospitals, which have been receiving most of the bad press. There are people that are unhappy with the VA hospitals and the VA system, but they're unhappy with it because it's underfunded, not because it's a bad system.